TBI stands for traumatic brain injury, and what that means is when the brain has an external force, such as a jolt or a blow to the head, even in some cases, a bullet injury that causes disruption in the function of the brain. And there are three types of traumatic brain injuries. There's mild, moderate, and severe. A mild traumatic brain injury is the most common form of brain injury. It accounts for approximately 80 to 90% of patients, and particularly those that we see in clinic. Moderate, there's different diagnostic criteria that we utilize, and severe tends to have more long-lasting deficits, and those are patients typically that would be seen in the hospital. A WAVI is one of the tools that we use in clinic to help diagnose a concussion. It actually is composed of 3 different tests. One of them is testing cognition. The other is testing something called evoked response potentials, which can be abnormal in concussions, which is the same thing as saying a mild traumatic brain injury. And then also it's an EEG, which measures brainwave activity. Concussion is a clinical diagnosis, but this is a tool that may help us reinforce the fact that the patient has had a concussion. The right eye is a non-invasive medical device that uses infrared lasers to help evaluate eye movements. Oftentimes in a mild or moderate traumatic brain injury, there can be eye movement abnormalities, and so it helps us understand how the eye and the brain are functioning together. The cool thing about this device, though, is that there's not only the ability to diagnose the problem between the brain and the vision, but also the ability to rehabilitate the patient. The balance plate, or B-Trax, is a portable device approximately the size of a scale that helps us understand if a patient with a traumatic brain injury or potentially a traumatic brain injury has difficulty with their balance, if they're a high fall risk, or if there's problems with their vestibular system, even things like proprioception, which is how well you sense the floor. And it's another tool that we utilize to help diagnose traumatic brain injuries as well as rehab the patients. The type of treatment that patients can receive if they have a traumatic brain injury include the right eye, the B-Trax, which is the balance plate, vestibular rehabilitation, and even active physical rehabilitation. On average, most patients will receive 2 sessions per week for approximately 8 weeks. After a patient has completed their treatment, they will be reassessed to ensure that there's been some improvement or progress in their condition. Common symptoms of a TBI include headaches, difficulty with balance, fatigue, mood lability, which means you cry more easily or get angered more easily. Those are some of the common symptoms we see with a traumatic brain injury. So an MRI with DTI stands for an MRI, or magnetic resonance imaging, with DTI, which is a diffusion tensor imaging. So what that translates to is a really detailed picture of the brain. We're able to look at really small structures in the brain, especially of the white matter, and determine if there's been any damage. We look at 3 different components within the MRI in addition to the typical features. One is how well the white matter tracts are communicating with each other. The other is if there's been any small microhemorrhages or tiny microscopic bleeds in the brain, which can be due to whiplash, for instance. And then also if there's been any shrinkage or atrophy of the brain structures that you can see with a traumatic brain injury.